You want to think of foam rolling almost as kind of a type of massage. When we foam roll, what it does is it relaxes the muscles that we're rolling, makes them a little bit more extensible so that when we move on to static stretching, we're going to get a little bit more out of the stretch. The two areas we're going to foam roll are going to be the quadriceps. When you perform the quadricep foam roll, you want to come forward, placing the foam roll beneath your thigh, your upper thigh, supporting yourself on your elbows and moving back and forth, up and down the thigh. You want to perform about 10 rolls. Now, if you find anything that's particularly tender, for me, I tend to get some tenderness down here just above the kneecap. You're going to want to pause on that and let the tenderness begin to ease. I usually wait until the pain or tenderness is reduced about 50% before moving on. Then what I'll do is I'll move on to the next area that's a little bit tender, pause on that until it releases, and then move on, completing about 10 rolls. Now, the second area we're going to do is called the quadratus lumborum. And again, this is a muscle in the back. The quadratus lumborum attaches to the vertebrae in the lumbar spine. So when it tightens up, it's going to start putting pressure on the lumbar spine, and you can actually start putting pressure on the discs in between the vertebrae. So when we do the quadratus lumborum, we want to roll onto the foam roller so it's in the lumbar area. Then from here, roll into the soft tissue area to the side, above the hip and below the rib cage. Just roll up and down a little bit, just like with the quadricep foam rolling exercise. If you find anything tender, pause on it, wait for it to release, move on to the next area. After completing about 10 rolls, move to the other side, performing the same exercise. Again, performing about 10 rolls on each side. Now the next section we're going to move on to is the stretching. And the stretching is where we're actually going to get a lot of relief going on. So stay with us. Okay, so what we're going to do now is we're going to cover a few basic stretches. These stretches should provide almost immediate relief. You should feel a looseness through your lower back and through your entire core area when you perform these. The first stretch we're going to do is for the hip flexor complex, right in through this area. There are 3 muscles that make up this complex: the iliacus, the psoas major, and for those people that have it, the psoas minor. The psoas major connects to your 5 lumbar vertebrae, and when it tightens up, what it does is it pulls on those vertebrae, and as those vertebrae are pulled, it creates a deeper arch in the back and actually begins pinching the disc between the vertebrae, and you get compression. That's what causes the pain. To stretch this area, place one knee up, other leg stays behind. Place one hand on top of the other on top of your knee and push down. What this does is engages the core, and it's going to allow you to keep your spine straight as you perform the stretch. After you've engaged the core, begin pushing the hip forward into the floor until you find a good stretch. Hold that stretch and try and relax into it. You want to hold for about 30 seconds. After you've completed 30 seconds of stretching, switch sides. Move on to the other side. Again, always placing one hand on top of the other, pushing down to engage the core. Keep the spine straight, and then push forward until you find a good stretch. You want to perform a stretch on each side anywhere between 3 and 4 times, logging anywhere between 90 seconds to 120 seconds of stretching activity. The next stretch we're going to do is for the quadriceps. Now, the quadriceps are the muscles in the front of the thigh, particularly the rectus femoris right at the center. This muscle attaches to your pelvis, and when it tightens up, it's going to pull the pelvis into a forward tilt. When this happens, the same thing happens to the spine that happens with the hip flexor complex. It causes the spine to overarch. Again, you get compression between the vertebrae on the discs, and that manifests back pain. To do this, what we're going to do is we're going to lie on our side. You want to put your bottom knee up to hip height or a little bit higher. When you do this, it essentially locks the hip, prevents you from hyperextending into the stretch. Take your top hand, grab your instep, and pull it around in behind you, keeping the knee low. Don't let it pop up. Keep the knee low and continue pulling until you find a good stretch. You're going to want to hold that stretch for about 30 seconds. After you've completed approximately 30 seconds, you can relax and move on to the other side. Again, bottom hand can grab the knee, or if you feel more comfortable, you can grab your inner thigh. Make sure the knee is at least at hip height. Top hand grabs the instep, pulls it in and around behind you, find a good stretch, hold for approximately 30 seconds. Just like with the hip flexor stretch, again, you're going to want to log anywhere between 1.5 to 2 minutes of stretching per side. And after you finish that, it should feel pretty good. The next stretch we're going to move on to is the quadratus lumborum stretch. We'll be right back. Okay, so the last stretch we're going to cover is for the quadratus lumborum. Again, that muscle in the back. Generally make sure that you foam roll this area before you stretch it. To stretch it properly, what you want to do is you want to place one hand over the top of the head, leaning to the side. Once you've been completely to the side, begin rotating forward until you begin to feel a pulling in the outside of the lower back. When you found that area, hold for about 30 seconds. After you've done that, relax and moving to the other side. Stretching to the side, gradually begin rotating forward until you find that area. And again, hold that stretch for about 30 seconds. And again, just like any area, if this is an area that's really bothering you, or it was completely, or sort of looking for very tender when you were foam rolling, you may want to stretch this area out a little bit